Hello, this is your video lecture for the Skeletal System, Chapter 5. A few things I want you to make sure that you have with you, as I always try to make sure I state prior to getting into the lecture, is that you have a notebook to take any notes into. You have a PowerPoint presentation, if there is a PowerPoint presentation associated with this chapter, and also have your textbook as a reference. Remember, the PowerPoint presentation is more or less like your outline of the things that you need to focus on. The video lecture will also be a reference or a resource that you can use so that you will know what you need to focus on in the textbook. In the textbook in this is chapter 7, it actually goes into more detail than what we're actually going to cover in the class. So please just make sure that you're writing the information down. Okay, I will be looking back and forth at the PowerPoint presentation that I have in my lap so that I'm making sure that I'm going along with the information that you need to follow. This is just going to be an overview. It's not going to be anything that's going to go into great detail, but I will highlight some of the information that you need to focus on as you go through your studies in preparation for your assessment. Okay, so if you're looking at the PowerPoint presentation, you will notice that it starts with arthrology, which is the study of joints. But I'm not going to start right there. I want to give you a little bit of general information in regard to our skeletal system. So if you skip down to, I want to say about the third slide, not including the title slide, it goes over the introduction to the skeletal system. I'll start there. The study of the skeleton is called osteology. If you have trouble with your bones, you go to an osteologist. And there's some general information that you probably already know. For example, you probably already know we have approximately 206 bones in the body. So that's a great thing if you already know that. But our skeleton has a multitude of different things that it does for us. It provides support, structure, protects our vital organs, and in addition to that, it helps us move in conjunction with our muscular system. But there are a few other things that you may not have realized about our skeletal system that it does. It's responsible for a process that's called hematopoiesis. I believe I first introduced this term in the section where we were, I think it was chapter 5, in tissues, where we were talking about the different parts of a long bone. A long bone has the epiphysis, which are the parts that are at the end, and it also has the diaphysis that we sometimes refer to as the shaft. In the epiphysis, or the ends of the long bones, is where hematopoiesis occurs, which is red blood cell formation. Because if you can recall, spongy bone is actually located in the epiphysis of the long bones, while compact bone is located within the shaft of the bone, or the diaphysis. In addition to those functions, our skeletal system also stores inorganic salts such as calcium, potassium, sodium, and also is responsible for energy storage. Inside of the bone, which is referred to as the endosteum, we will find what's called yellow marrow. I know we've heard of red bone marrow and spongy bone, cancellous bone. They are all synonymous. We know we've heard of that, but there's also what's called yellow marrow. And yellow marrow is found where the diaphysis and the epiphysis actually meet. It's called the epiphyseal plate. This is the area in which the long bones allow for growth. And so you will find that yellow marrow there, and the yellow marrow just as fat. And if you think about fat, a lot of times fat has a yellowish tinge to it. And fat is actually an energy source. So that's another function of our skeleton. Okay, so if you go to the next slide, it begins to talk about bone structure. And I've already identified one of the types of bones, and that would be long bones. And on that slide, you will notice that it identifies several different classifications of bones. We have long bones, we have short bones, we have irregularly shaped bones, we have flat bones, we have sesamoid bones that are also referred to as round bones. It's really important that we know the differences between them. So I'll give you an example. The femur is considered a long bone. It happens to be the bone that's in our thigh. It's the largest and the longest bone in the body. But we have others like our humerus, the radius, the ulna, the tibia, the fibula. They are all examples of long bones as well. Short bones are typically kind of cube-like. You'll find those in our wrists that are called carpals, and you'll also find them in our ankles that are called tarsals. Flat bones are those that are just like it indicates, flat. We have some cranial bones that are considered flat bones, like our frontal bone and the parietal bones, but also our sternum, which is our breastbone, is a flat bone. Our clavicle, which is our collarbone, is also a flat bone. Irregularly shaped bones are those that are irregularly shaped. For example, the vertebrae, the cervical vertebrae, the thoracic vertebrae, the lumbar vertebrae. They have no real shape. They're not really flat. They're not round. They're not cubed. They're just irregular. So thus they have been classified as such. And sesamoid bones are also referred to as round bones. And the best example to be given there would be the patella, which is also known as the kneecap. Okay. Then it begins to talk about the divisions of the skeleton. This was probably introduced in chapter 1 when we talked about the axial and the appendicular division. Well, now that we're going to springboard that to the skeletal system, because there are different bones that are part of the axial division and different bones that are part of the appendicular division. The axial skeleton is sometimes referred to as the body proper because it's made up of the head, the neck, and the torso. And all of the bones that comprise that region are called the body proper, because we can exist as just a head, neck, and torso. The appendicular skeleton are the bones that make up our upper and lower extremities. And these are the ones that whatever you have on one side, you have on the other side. So when you're looking at your syllabus, or if you're looking in Blackboard where it actually gives you the objectives of this chapter, a lot of the information that's located there is knowing what the bones are and where they are located. It's a little bit easier to go through the appendicular division because whatever you have on one side, you have the same thing on the other side. And I'm not as concerned that you know the number of bones that are in each division or each part of the skeleton, more so than I am you knowing the bones themselves. So make sure you take the time to focus on that. Okay, the next slide begins to talk and go right into the bones of the cranium. But before we do that, this is where I'm going to go back to arthrology to talk about joints. A joint is an articulation between one or more bones. And all that means is it's where one or more bones actually meet. That's what an articulation is. And we have different types of joints. We've got joints that will allow for free movement and rotation, such as ball and socket joints like our shoulder. We have those that are referred to as hinge joints that only allow unidirectional type of movement. We have slightly movable joints. We have permanent immovable joints. And that brings me to what I wanted to say before we get into the bones of the cranium, are those permanent immovable joints. They are referred to as sutures. So if you look at the diagrams in the textbook, and please make sure that you do, the diagrams in the textbook will actually show you the different types of sutures that are in between the cranial bones. And they literally interlock, but they don't start that way because during infancy, obviously the size of our head is a lot smaller than it would be as we would be adults. So those permanent immovable joints can't start like that. They actually start as what we sometimes commonly refer to as soft spots, but they're called fontanelles. And a fontanelle is just an area on an infant's head that's made up of dense connective tissue that will allow for the growth of the cranial bones without having those bones fused together. So if these are the parietal bones, which actually make up the tops and sides of the head, those fontanelles are located, that connective tissue where my fingers are not meeting. As we continue to grow and those bones grow, they will come together and they will fuse into those permanent immovable joints that we refer to as sutures. So those joints actually if you look in the textbook and you go to access the interactive art quizzes of the cranium, which is going to be really important that you do so that you can access the anterior view, the lateral view, and maybe if they have a superior view to identify those different parts, you would actually see sutures. There's one that comes across this way. There's one that actually goes down the center of our head. There's another one that's kind of at the back here. And there's another one that's kind of jagged at the side there. And they actually have names. The most anterior suture that comes across here is called the coronal suture. The suture that goes down the center that divides these two large bones on the side is called the sagittal suture. The most posterior suture at the back is called the lambdoid suture, and the two sutures that are located on the sides are called the squamous sutures. So that will help us understand where the bones or the cranial bones are located. Now it's important to understand that the cranial bones encase the brain, and we have a total of 8. There are 6 that are on the surface and 2 that are interior. Anytime we are referring to bones of the skull, we are including cranial and facial bones. So cranial bones are only those that will encase the skull, encase the brain, and the skull encompasses not only the cranial bones, but also the facial bones. So if you're looking at the PowerPoint presentation, it identifies where the bones are and how many we have. So the first one you'll see is the frontal bone, which is the bone that makes up our forehead. After that, we have 2 parietal bones, which are the largest bones of the cranium, and they're located on the top and the sides of the head. And these happen to be the 2 bones that articulate or meet with all of the cranial sutures. We have the occipital bone, which is located at the posterior region of the cranium. And the thing about what's interesting, or not interesting, or what we need to know about the occipital bone, it has a very large hole in it that's called foramen magnum. Anytime you hear the word foramen, F-O-R-E-M-A-N, it's referencing a hole. So if I say mental foramen, even if I don't know where it is, I know that I'm looking for a hole. If I say mandibular foramen, I may not know where it is, but the word foramen is telling me that it's a hole. F-O-R, R-A-M-E-N, foramen. Okay, and so on that particular slide, you'll notice that there is one occipital bone has the foramen magnum. The importance of this particular bone and that particular anatomical structure is that in cases of decapitation, we can use that foramen magnum to reattach the head to the rest of the torso by using some type of either PVC piping or some other type of dowel to actually go through that hole in order to resituate the head back onto the torso. And then, of course, when you get to restorative art, I will teach you the process by which we would actually keep that head stabilized on the torso. But that's the importance of that particular anatomical structure in that bone. And in addition to that, the foramen magnum, the foramen magnum being a part of the occipital bone spans the posterior region of the cranial floor. Okay, moving on to the next slide, it begins to talk about the temporal bones. The temporal bones are located right here. When we think of having a headache, sometimes you'll rub your temples. Well, this is where the temporal bones are. But the importance of the temporal bones is that they will help us to accurately reattach an ear. It gives us 4 anatomical structures that will help us to accurately reattach an ear. Now, the interesting thing about it is that there are a total of 5 anatomical structures that we identify, but only 4 of them are used to accurately reattach the ear. Those 4 include the zygomatic arch of the temporal bone, the mandibular fossa, the mastoid process, and the external auditory or acoustic meatus. Those 4 are used to help us accurately reattach an ear. However, the fifth one, the styloid process, is also on the temporal bone, but it's too far interior to actually act as an anatomical structure to help us reattach an ear. So, external auditory meatus, zygomatic process of the temporal bone, mandibular fossa, process. I said external auditory meatus, zygomatic fossa. Yes, those four. Zygomatic process of the temporal bone, external auditory meatus, mandibular fossa, mastoid process. The fifth one, the styloid process, is not one that we use to reattach the ear. Now, I've used some terminology that you might be saying, well, what are those different words that you're using? A process is a projection. A meatus is a passageway. A fossa is a shallow depression. Also, in the previous slide, you probably saw the word condyle. A condyle is a rounded projection. Okay? All right, so the next slide begins to talk about the two cranial bones that are actually in the anterior floor of the cranium. So they don't have any influence on surface form because they are actually on the floor of the anterior portion of the cranial cavity. And that's the ethmoid bone and the sphenoid bone. The sphenoid bone looks kind of similar to a butterfly or maybe even a moth. If you look in your textbook, it actually shows you the bone and you can actually see where it spans the anterior floor of the cranium. And the ethmoid bone is just anterior to that. The ethmoid bone is an irregularly shaped bone, as is the sphenoid bone. However, the ethmoid bone has particular importance to us because there is a process or a condition that exists during but it exists in our process of embalming, or it's a situation that could occur that's referred to as purge. Purge is the extravascular escape of a fluid, of a solid or a semi-solid from the inside of the body to the outside of the body through an orifice. An orifice is an opening, such as the nostrils, the mouth, the anus, the vagina, anywhere that fluid or any type of bodily material that's on the inside could escape out. That would be an orifice. Well, purge comes in three consistencies. It can either be like a coffee ground, brown, and very malodorous. That would be considered stomach purge. Or it can be a frothy, whitish, pinkish consistency. If it's frothy, that's going to indicate to you that it's coming from the lungs. So that's lung purge. And it might be a creamy white, it might be a frothy whitish, grayish, pinkish. The reason why it might have a different coloration to it is if it's tinged with blood, it might be more of a pinkish kind of color. And there could also be what's referred to as like a creamy, milky kind of whitish or pinkish purge that may come out of the nose. And that will be brain purge. Now, what that is indicating is that within one of these cavities, be it the abdominal cavity, the thoracic cavity where the lungs are, or the cranial cavity, there is decomposition that is going on. And so the pressure inside of those cavities causes the escape of the fluid, solid or semi-solid, from one of those orifices. Now, what's very important to understand is that you will always treat the cause and not the symptom. The symptom would be seeing something come out of the mouth, and you treating the symptom would just be taking a tissue to wipe it off. But you haven't treated the cause, which means it will happen again. So the reason why I bring this up, particularly in regard to the ethmoid bone, is because the ethmoid bone will help us to gain access to the cranial cavity. It's perforated with a cribriform plate that looks like it has little holes in it. And what I can do in order to treat the cause of what may be going on in that cranial cavity is to take a needle and syringe and literally introduce it into the nasal cavity, because the ethmoid bone is located just posterior to that nasal cavity. When I take my needle and I go through the nasal cavity, I can pierce that cribriform plate of the ethmoid bone. And when I do, I can literally withdraw or aspirate the fluid or the semi-solid or whatever is causing the purge out of that cranial cavity. So as I do that and then I expel it into the slop sink and I do it some more and I expel some more, I am removing as much of that fluid as I can, but I'm not finished. Once I aspirate as much of it as I can out of that cranial cavity, then I will go back and reintroduce an astringent fluid, either my arterial fluid or cavity fluid, to arrest any further decomposition inside of that cranial cavity. Now remember, we can't stop decomposition, but we can greatly retard it. So not only am I treating the symptom, which would be either the purge coming out of the nose or the mouth, but I've gone back in and I have treated the cause. So please make sure you know the 3 different types and consistencies of purge. Okay, so we have gone over the cranial bones, and looking at the PowerPoint presentation now, it moves into the facial bones. All of the facial bones you are required to know, with the exception of the lacrimal bones and the palatine process. And then on the next slide, the inferior nasal concha. Those you do not need to know for your assessment. However, you do need to know the nasal bones. We have 2 that are held together with a tight suture. The zygomatic bones are the bones of the cheek. We call them the cheekbones. The maxillary or the maxilla is the bone that makes up our upper jaw, and it has what are called the alveolar processes. Remember, a process is a projection, and there are the little sockets. If you run your finger across the top, you can actually feel the little ridges. They're designed to literally hold your teeth in place. And we'll talk more about that when you get to restorative art. But the maxilla is actually, there are 2 bones, and they actually start way up here. They border the lower rim of the orbit of the eye. They actually meet with the zygomatic bones, and they form the medial border of the nasal cavity. And of course, all of this, the upper jaw. Then you would skip the palatine process and the vomer. There's only one vomer, and you actually cannot see it unless you remove, well, we can't see any of the bones, obviously, but it's located within the nasal cavity. It's the long, thin bone that actually our septum, which is made up of hyaline cartilage, our septum rests right atop it. And if you look at the diagrams in your textbook, you will be able to see a very long, thin bone that's within the nasal cavity. And then we have one mandible, which is the single movable bone of the face. The mandible is the bone of our lower jaw. It has 3 regions to it. It has the vertical region that's called the ramus. The corner is referred to as the angle, and the greater portion of the mandible is called the body. In addition to that, if you put your finger right here and you open and close your mouth, you can feel the mandibular condyle rocking back and forth in the mandibular fossa. Okay? So the most superior anterior anatomical structure on the ramus is called the mandibular condyle. While back here, we really can't feel it, but it's the most superior posterior anatomical structure, which is called the coronoid process. So on that ramus of the mandible, we have 2 additional anatomical structures. The anterior anatomical structure is called the mandibular condyle, and the posterior anatomical structure is called the coronoid process. In addition to that, you'll notice if you look in the textbook, there are 2 holes here. So you may not know exactly what they might be called, but if it's a hole, you do know it's a foramen, and they are called the mental foramen. We'll talk more about those when you get to restorative art. Okay, so those are the cranial bones and the facial bones. Now we're getting into the next slide, which goes over the rest of the bones in the axial skeleton. The hyoid bone, its importance is that it supports the tongue, and it's the only non-articulating bone in the body, which means it does not touch any other bones. And then we have the vertebral column. You'll notice that with the vertebral column information, I've only listed the first two vertebrae, but we actually have different types of vertebrae. The vertebrae that are located in the neck are called the cervical vertebrae, and we have a total of 7. The thoracic vertebrae actually make up the thoracic cage, or they are part of the thoracic cage, and we have a total of 12, just as we have 12 pair of ribs. Each pair of ribs attached to one of those thoracic vertebrae. They're medium sized, cervical are the smallest. The largest and the strongest vertebrae that we have, and we have a total of 5, they are called the lumbar vertebrae. Just inferior to the lumbar vertebrae, we have the sacrum, which is made up of 5 fused bones. And the most inferior portion of the vertebral column is the coccyx, which we also refer to as our tailbone, and it's made up of 4 fused bones. Now, with the vertebrae, we only identify 2 of them by name. The first 2. The first cervical vertebrae is called the atlas, and the atlas is responsible for supporting the weight of the skull. The second cervical vertebrae is called the axis, and it allows for side-to-side movement. The rest of the cervical vertebrae are just appropriately named in number C3 through C7. You can also refer to the atlas as C1, and you can refer to the axis as C2, but they are the only 2 named vertebrae. And then the thoracic vertebrae would just be T1 through T12, and the lumbar would be L1 through L5. Continuing to look at that information, in between the vertebrae, this is worth noting, in between the vertebrae, we have what are called intervertebral discs that are made up of hyaline cartilage, and they are literally like shock absorbers located in between each one of the vertebrae, so that if you should be jumping, those bones just don't hit upon one another. They actually have that cartilage in between for protection. And then we have the breastbone, which is referred to as the sternum. The most superior portion of the sternum is called the manubrium. The greater portion of it is the body, and the most inferior point is called the xiphoid process. The rest of the thoracic cage is composed of the ribs. So as I indicated, there are a total of 12 pair of ribs, each pair of ribs attached to one of the thoracic vertebrae. The first 7 pair of ribs actually attach directly to the sternum, and they are referred to as true ribs. Rib pairs number 8 through 12 are referred to as false ribs because they do not attach to the sternum directly. They actually attach to the cartilage of the rib that precedes it. So the cartilage of rib pair number 8 the rib pair number 8 attaches to the cartilage of rib pair number 7. The rib pair number 9 will attach to the cartilage of rib pair 8, so on and so forth. But within those 5 pair of false ribs, we have 2 pair that are called floating ribs. And that's rib pair number 11 and rib pair number 12. They're called floating because they do not articulate anteriorly at all. Not cartilage, not the bone, not anything. So rib pair 11 and 12, although they are considered false ribs, we call them floating ribs because of they do not articulate to any rib or cartilage at all. So that took us through the rest of the axial skeleton. Now we'll move right on to the appendicular skeleton. Really pretty easy because, like I said, whatever you have on one side, you have the same thing on the other. But it's important to understand that we have girdles. We have the pectoral girdle, which will attach the upper extremities to the axial skeleton, and we have the pelvic girdle, which will attach the lower extremities to the axial skeleton. So anteriorly, that portion of the pectoral girdle is the clavicle, which we commonly refer to as the collarbone. Posteriorly, that attachment point is the scapula, which we commonly refer to as our shoulder blade. And then we just go down the arm. The long bone of the upper arm is called the humerus. And it's important to remember anatomical position. So it's as if I'm standing, let me stand up, like this, palms up, okay? So this would be humerus, palms up. The lateral bone of the forearm is called the radius. The medial bone of the forearm is called the ulna. So don't get that backwards. Remember, anatomical position, your palms are always up. So on the thumb side, anatomically, the lateral side, we have the radius. On the pinky side, anatomically, the medial side, we have the ulna. Then the bones of the wrist are the carpals. The bones that make up the framework of our palm are called the metacarpals. And